transducer has this curved kind of near field. So because we're going to be using linear, it's going to be flat. So that's how you know what's going on. So on this machine, I'm going to go up here. I'm going to select my probe. On the other machine, Sequoia's, there's like it's called exducer button. And then on the Philips, I think it just says transducer. And then on the GE, you actually select it on the soft screen up here. So let's switch this. 14 linear. And it's going to put me on a breast setting. We're going to go to a thyroid setting. When I was a student, I was like the volunteer for the breast. And the lady just jerked and she's like, well, most people have more breast tissue than this. Oh, sorry. Females volunteering at their boobs. Wow. Stand here, okay, lady? Okay, so we'll talk a little bit more about the prep for this next week when we do thyroids. I usually use, out in the real world, I use 2 washcloths. I kind of do the corner one here and the corner one here. We'll talk about that next week. But today we're just going to worry about lymph nodes. And as far as other prep, when you're doing stuff like this, making sure that your patient doesn't have any necklaces on, things like that. And I'm sitting right now, but for my thyroid exams, I usually stand. So it's just easier for me to kind of get over on my patient. Let's see what we can find here. So, linear transducer, not in my patient's face. Oh, it didn't do something. All right, go ahead and turn your head slightly toward me. So we're going to worry about thyroid kind of later. Why does this seem so wild? But here is our thyroid. So we've got this kind of image we saw last quarter. So here's trachea, we've got carotid and jugular over here. Here's our strap muscles, this is going to be our sternocleidomastoid. Strap muscles again, sternocleidomastoid. Longest colli is going to be in the back. We've got a little esophagus. Go ahead and swallow for me. Ooh, there's her esophagus. And what we're going to be focusing on is we're going to center the common carotid and the jugular. And you can see I can, with enough pressure, I can collapse that jugular, what we call coapt. Doesn't matter if he is or not, but we're going to start scanning. Just got some nice lymph nodes right in here. See how these are little blips? So let's look at the muscle for example. So if I'm inferior down here, and I'm going towards superior, see how the muscle stays? Kind of stays there, or like vessels kind of stay there and they go. But lymph nodes are going to be little blips. So see how these ones disappear? So she's got one right here. There's kind of a second one right below it, right in here. So those are her lymph nodes. So to annotate this, we are left, lat, neck, transverse. So we could zoom this guy if we want to, but he's pretty prominent, so we'll just kind of leave him right where he's at. So our first image, we're going to get kind of the largest size on him. Now again, you can do AP and transverse, or you can do AP and sag. Doesn't matter to me. So our first image we're going to take is, my printer's on, let me see it. Is without calipers, and then we're going to caliper the longest length of this bad boy. So it may not be completely sag or transverse. We're just going to go with his longest length, and then we'll get another. Oops. Hey, where'd you go? Oh, what happened to you? Hey. Making me bonkers, folks. Okay, all right. Shay's an idiot. How do I delete my caliper here? Okay, well, I don't know what we're doing. We don't know. Nobody knows. It's a mystery. Okay, so there's my first set. We're going to do AP, my second set. So that would be our first image is without calipers. Our second image is with calipers. I want to make sure we're annotating where we're at. Next, we could throw some color on, depending on whether we see it better in sag or transverse. I'm really an idiot at this, aren't I? What is going on here? Size, too, position. Come again. There we go. Okay, so pretty high velocity for what we're looking at, so I'm going to actually just drop our gain down. We should see just a little bit of a blip of color within that lymph node. There he is, kind of sitting right there. So representative image with color. And now we're ready for Sag. Okay, this is, oh, I know, this can be tricky to go from Sag to transverse on the same lymph node. So you kind of fan as you go, keeping it in your field of view. But see how much longer he lengthened out? And so again, there's no absolute measurement for lymph nodes, and the ones in the neck get a lot longer, or the ones that are surrounding any kind of vasculature are going to get a lot longer because you're trying to take up more surface area of the vessel, whereas ones like in the armpit are going to be a little bit more bean or round shaped. So our last image is going to be with caliper. And that's it. Very exciting, like I said. So it might be difficult to find lymph nodes. I'm going to drop this down on the freezer. It might be difficult to find lymph nodes on some of you guys if you're very healthy. They're just very small and kind of hard to see. But she had a little bit of a prominent node, so it made our lives a little bit easier. I'm going to leave you gooped up if that's okay.
Okay. Yep.
All right.